Everybody wants their body healed from injury or illness. Everybody wants that. But I mean, I'm not a person to turn myself over to somebody that I don't trust, that's gonna hurt me or not help me. And so to just have that feeling that I didn't have to hesitate, that I do have somebody right down the alley that I can go to and I can trust. It's wonderful.
You know, we don't turn anybody away, and we treat everybody with respect when they come in, with a warm welcome, because a lot of these patients really don't have anywhere else to go. We're kind of the last line of defense in regards to teeth. And I see myself in the same shoes 30 years ago when I was on DSHS and my mom was taking me on the bus to my dental appointment. And you know, I feel like I'm giving back, and if things were turned around, that's exactly how I would want to be treated.
We really try to make this place a place where people come and they're known. I think that's sort of what we've always been.
Yeah. Even 6 years ago when I first started, most of the staff referred to the clinic as a family. The clinic staff members were a part of that family, the patients were part of that family.
You get full life stories of patients, you get things that they don't tell everybody. They feel like we're family to them.
Before the healthcare home got kind of coined, we were already talking about that.
The fact that you can receive healthcare in your school, that really, you can get over a lot of barriers by having that available. It's a very foreign concept to a lot of people, but I think it's really neat that Seattle and specifically Neighborcare, they're pushing to make these norms.
When I close the door and the student comes in and they sit down and I'm asking them about those personal questions, how can we help you be healthier in your life? Those questions are asked in a way that says, whatever you tell me is okay, and then let's figure out what to do with it.
You know, if you don't feel like you get that love at home, then you feel like you can come in there and it's like another family.
And she knows pretty much everything about me when it comes to boyfriends and girlfriends and just problems I have at home or at school, but she's like another mom.
A healthcare home is something that's at the roots of who Neighborcare has been forever and always was. And that is meeting people where they are to help them improve their health and have the life that they're looking for. Helping someone who's homeless find their space and accomplish what they want to from a health perspective, and not about judging them or trying to move them to a place of health that's just not going to happen anytime right away.
I think we have that wraparound services and do as much as we can to make sure that they have that kind of support.
I have a diabetic for a long time ago, about 20 years ago. But right now, I control. That's why I think you're very good doctor. Like both of them, very friendly. Yes, that's why I want to come here.
It's an incredible resource, and I think for many people, healthcare is difficult, and to make it where it's easy to access and to make it where you know you're going to be treated well, you know, I think it makes a huge difference. To know that there's a resource like this is amazing, and to be able to refer people both in my personal life as well as professionally is really valuable to me.
วันไหนต้องไปหาหมออะไรเงี้ยไปเทคแคร์ป้ามาตลอด
I trust the interpreter, I trust the doctor, and everyone there is very nice to me. It feels like home to me.
I don't mind at all going there. If they say you're going to the doctor, I'll say that's okay with me.
This is a great place to be during health reform. This is the place where it's going to happen. It's an exciting time. It's a nerve-wracking time a little bit. It's a lot of change. I think we all feel like we're on a little bit of a roller coaster. The communities that we serve is where we're really going to see a difference in the way in which people define health and the way in which they're able to access healthcare. I couldn't think of a better place to be right now for health reform.
It's not a free program. The government's not intruding into the healthcare sector. It's just people having access to healthcare, access to a provider.
The Affordable Care Act is made up of 1 million stories, and many of those stories are from our Neighborcare staff.
Because that's what we're trying to create. You know, a home, a trusting place that you can come, particularly for people who haven't had good medical experiences or access. We can't fix everything, and we know that, and sometimes we have to ask for help, but that people can come and start, and we'll care, and we'll get it done. We'll get the job done.